ALS is a very challenging disease with multifactorial. There's been a lot of failures, but some recent success. So, that I think we're getting there and learning more about the biology and what you might be able to target to make a difference. And we are looking at different targets in ALS. The target that is the most advanced for us that we believe plays a key role in the biology of ALS is TDP-43. So TDP-43 under disease conditions in ALS patients, instead of residing in the nucleus where it belongs and is being involved in RNA processing, protein expression, it tends to form cytoplasmic aggregates in the patients, which are toxic and non-functional. So you have a loss of function and toxicity. And those TDP-43 aggregates are present in 97% of patients with ALS. So you'd be able to help across the board ALS patients, not just the ones who have rare mutations, which is a very small population. So there we've applied the same platform technology that ProMIS has that we applied to other protein targets, which is a computational algorithm that can model how protein might misfold, like TDP-43, and become toxic, and then expose some conformational epitopes, so some small misfolded regions that become exposed only on the toxic form of the protein and not on the properly folded form of the same protein. And then we can immunize with just that little piece and generate antibodies that are selective for the toxic form of the protein. And that's particularly important with TDP-43 because it's such a crucial protein for normal neuronal function that you want an antibody that will be very selective for just the toxic form of TDP-43 and not interfere with normal TDP-43. So there we've made great progress. We have a lead candidate, PMN-267, that is selective for misfolded TDP-43, does not bind normal nuclear TDP-43. And it's an antibody that has protective activity in vitro. We've also seen signs for improving motor function in a model of ALS in mice. And we've also generated an intrabody form of the antibody, so something that could be put in a gene therapy vector to deliver inside of neurons if we wanted to do that as well. So we have these two configurations. So an antibody that could block cell-to-cell spread of misfolded TDP-43 and an intrabody version that could be used to deliver inside of the neurons. And in addition to that, deal with the aggregates that are already formed. So we have our lead candidate, it's humanized, and it's ready to enter IND enabling studies, the kinds of studies that you need to support an IND application.